New tonight at 6, hundreds of COVID vaccine doses can't be used, and they're simply being thrown away.
NBC4 investigates Jamie Ostroff was the first to report that providers throughout Ohio have had to discard some 1,300 doses. She wanted to know more about those providers and why those doses were tossed. She joins us now. What have you learned?
Well, Carrie, whether it's a broken freezer, a bent needle, or human error, when a vaccine provider cannot get a dose into someone's arm, they have to report it to the state as unusable. I asked the Ohio Department of Health to send me a list of every unusable dose in Ohio, and that list named 16 providers in central Ohio. I reached out to all of them. A dose here, 20 doses there. I obtained this data from the Ohio Department of Health of every COVID-19 vaccine dose providers say they can't use. Out of about 1,300 statewide, roughly 1,100 are in central Ohio, 9 from OSU Wexner Medical Center.
Out of 33,000 doses that we've given.
That's Dr. Andrew Thomas, Wexner's chief clinical officer. He tells me what happened with those 9 doses is pretty standard in medicine.
A couple of syringes that had gotten dropped, then needles that had bent when they went to use them, or if there was a leak between the needle and the syringe.
Several providers told me something similar when I asked them what happened. Delaware General Health District said bent needles cost them 2 doses, and a health official in Union County said a dose was lost when a patient jumped after the needle went in. Mount Carmel spokesperson Samantha Irons said syringe issues plus a few leftover doses that couldn't be used in time cost the health system 11 doses. That said, we know that even 1 dose wasted is too many, Irons told me in an email. We are constantly reviewing and changing our vaccination process to ensure we avoid unusable doses. Franklin County Public Health reported 29 due to human error and syringe issues. That's according to a spokesman who also pointed out that nurses extracted an extra 362 doses from vials containing excess vaccine. Not every provider was as easy to reach. Shriver's Pharmacies has 7 locations in southeast Ohio. It reported 90 unusable doses. Hi, my name is Jamie Ostroff. I am calling from NBC4. After 2 days and multiple phone calls, I never heard back. Then there's Specialty Rx. The Columbus vaccine provider lost 890 doses last month by not monitoring the storage temperature. It even caught the governor's attention.
That infuriated me. It never should have happened.
Specialty Rx was suspended as a vaccine provider. It has not responded to messages left at its New Jersey headquarters. So we created this interactive graphic for you. You can see here by this huge circle, Specialty Rx has gotten rid of the most or had the most unusable doses, not only in central Ohio, but in the entire state. So if you want to know if your local pharmacy had to get rid of any doses, it's all on here. You can check it out at NBC4i.com.